Well, welcome to the Berwick Village Vet. I'm Jeremy Jones. I'm the principal vet here at this vet clinic. Certainly, I think the issue we're going to talk about today, namely arthritis, is a very important problem. It affects many dogs and cats, and we're presented with cases quite often. So today we're going to talk about what is arthritis, what are the signs of arthritis, what would you notice at home, and what we can do about it. So let us discuss each one in separate little sections, and we'll take it from there. So I guess the first thing to consider is, what is arthritis? I guess there's a few different things involved in arthritis. You would have heard of people with rheumatoid arthritis. In dogs and cats, we more talk about arthritis as degenerative joint disease or osteoarthritis. It's a non-infectious form of degenerative change in the joints. And it can occur for two main reasons. One, primary degenerative joint disease, it just happens. Over time, the joint just wears away. We're not entirely sure of the exact mechanisms, but it does end up in an arthritic joint. The second is when something goes wrong in a joint. You might have hip dysplasia, hips that aren't made quite right, or perhaps a ruptured ligament in the knee, just like the footballers do, the cruciate ligament. And that leads to bony changes, and the cartilage breaks down, and over time a dog will, or a cat will, feel pain and inflammation in that joint. I have a diagram here of a hip joint with hip dysplasia. Hip dysplasia is it's a developmental problem where the hip ball joint doesn't fit properly in the socket of the hip joint, and it leads to laxity and over time increased wear and tear in the joint. You can see here, this is the side of the pelvis. This is supposed to be the acetabulum or socket joint of the hip, and you can see there's bony growths and extra proliferation of the bone here. You can also see here on the head of the femur there's no cartilage left there at all. This dog would be significantly lame. And on the head and around the head of the femur, you can see more of the bony growth here. It's a continual process for these older dogs. They would be very uncomfortable, and it causes a lot of pain. And it's our job to try and fix that as much as we can. I've got some x-rays here of a cat's x-rays of a cat. It's 15 years old, and you can see here a few changes. There's this increased whiteness on the x-ray all through this elbow joint, all the way down through here, and on this side we've got a few patches through here. These are all signs of ongoing arthritis in a cat. This cat was significantly lame and has provided a bit of a challenge clinically to try and get it right. So let's now talk about the signs of arthritis in your dog and cat. I think the most common sign would be stiffness in the mornings. You notice your dog getting out of bed, they seem to take a bit longer than usual. They stand there, they stretch each of the joints, and then they get on with their day. As it gets worse, you'll find that they actually get up and they spend a good 20 minutes warming up before they get those joints working properly, and then they're often fine for a little while. As it progresses, they'll get even more sore. So you'll find them after exercise pulling up lame. You'll see sometimes it's just a little bit of stiffness, soreness. Putting on the brakes, they just won't go any further. The walk is over, let's go home, mum and dad, please. Sometimes it's obvious. Holding up a leg, holding up a paw, clear evidence of pain. Most of the time it's not that obvious, especially in the earlier stages. Cats, even harder. Cats don't really let us know what they're thinking very much. Evolutionarily speaking, they love to hide their thoughts. Probably the most common one would be, my cat used to jump up on the bed and now it just looks at me. Very common. Same with the tables. Cats that have been fed up on top of the washing machine, things like that. We see commonly that they can't jump up anymore. I think the statistic would be quite amazing as to how many dogs over the age of 7 or 8 have some kind of arthritis would be probably fairly similar in people over the age of 40 or 50, just a sore joint here or there. We tend to cope, we take painkillers, we take glucosamine supplements and things like that. It's very important to really look at your pet and decide whether they look a bit stiff. It's very common that, you know, slowing down that you've noticed over the past year as they get a bit older isn't just old age, it's probably the fact that they're getting a bit stiff and sore. So let's now talk about what we're going to do about it. I think there's a multiple tiered approach you can take, and the first is to start them off on things that are very safe, things that are very effective long term, not necessarily pain blocking. Let's just aid the health of the joint. And I guess there are two main things that we use here: fish oil and glucosamine. Now the fish oil comes in many forms. You can get it anywhere these days. On TV they're advertising super wild krill oil, these kinds of things. Scientific basis is proven on fish oil. Its actual effect in arthritis, a little bit yet to be proven, but certainly so safe, so good for them in general, I don't think I'd hesitate in recommending a fish oil of any sort. Glucosamine, again, another fantastic product. There are so many types out there. You've probably read thousands of brands advertised throughout on TV and on the radio. I've chosen Sasha's Blend. I think it's a great product. It seems to have the green lip muscle extract, which helps with both the joint. It works, it has anti-inflammatory, and it also has glucosamine in it. Glucosamine is a building block for cartilage, so it's fantastic. What we're trying to do is to keep that cartilage shock absorber for as long as we can. Another great treatment option that we use quite regularly is Pentosan. Pentosan or Pentosan polysulfate comes made by a few different brands. It's a really safe alternative. We do use it with caution in cats or dogs with kidney problems and liver problems, but on the whole it's a very safe product. It's given by injection once a week for the first 4 weeks, and we follow that up with monthly injections. It's amazing. A lot of dogs just seem to get fluid in their joints. You can see them moving easier. They're a lot more comfortable. Highly recommended. Well, what do we use when those other products aren't working? They're great. Fish oil, glucosamine, Pentosan. Fantastic products, but they're often not enough. They're good in the early stages. They're good all the way through as a maintenance product, but sometimes they're not quite enough. Then we tend to look at anti-inflammatories. There's a few different brands out there. A lot of the different brands are just generics of the same drugs. The main two drugs are carprofen and meloxicam. So carprofen, the common trade name, is Rimadyl. Rimadyl is made by Pfizer. Very, very good product. Comes in tablet form. Works very, very well. Different dose rates suit different dogs, but it works at getting rid of the inflammation in the joint, and it also helps them by blocking the pain so that they feel a lot better, and over time their joint health actually improves. Same with the meloxicam. There's generics meloxicam, there's Metacam, which is one of the earlier brands. Fantastic products. Metacam I use in the tablets quite a lot. Fantastic, easily taken, they like the beef chew. The meloxicam itself, the Ilium brand, it's a liquid, so easy to give. If your dog doesn't like taking tablets, the liquid is fantastic. Again, it's that type of product that gets into the joint, takes away the inflammation over time, blocks the pain, and really works at getting your dog or cat back to a normal lifestyle. We sometimes can't fix arthritis. What we need to do is manage it. Let them age gracefully and comfortably. Well, I hope this little video has been of some help. Certainly it's a very important problem, and we see so many cases that it is something that we need to address. Have a look. It's now up to you. Go and check out your dog. Have a look at them. How do you think they're doing? Do they seem stiff? Do they seem sore? Do they seem slow? It might be high time to get them onto a glucosamine supplement and a fish oil supplement. And if you need further advice, if your dog's really looking sore, make sure you get in contact with us. We're professionals. We've seen all this before. We really want to see your dog as happy as we can get them. So cats too. sometimes the signs are a bit milder. So make sure you really look at them with a critical eye and say yes or no. Are they in pain or are they quite comfortable? So I hope you enjoyed it, and if we can be of any help, please give us a ring, 9707 3855, and one of the girls will book you in an appointment and we can make a plan that's suitable for your pet. Okay? Bye for now.